Hi, this is Dr. Matthew Mitchell, and in this video, we're going to tackle a really controversial question, and that is, why is healthcare so expensive in the United States? Why is it so drastically more expensive than it is in other countries? And previously in our class, we talked about this idea of inelastic demand, that one of the challenges with healthcare is unlike other consumer goods, the ideas of supply and demand don't always apply. In other words, that oftentimes as supply of something increases, that drops the cost. As demand increases, that increases the cost, right? Well, unfortunately, with healthcare, and particularly emergency healthcare, um, you know, there's an infinite demand for that, right? Where we at no point, as the need for that need for that healthcare goes up, is there a change in price or a change in any other economic aspect of that? And so we talked about in class how this is one of the challenging things with healthcare is that, oftentimes when it comes to healthcare, as they say, you can't put a price on a life. You can't, which is part of the reason why these costs can get very expensive. And without cost controls, like we see in other countries, that can be problematic when it comes to the United States. And so we talked about that a little bit and talked about the EpiPen and its role in that. And so let's look at some of these reasons why. And I'm going to try to be as objective as I can in this video, as we're going to tackle quite a few of these aspects of or questions or answers or of what may be some of the reason why. If we want to be honest, I don't know that any of these is the right answer. Some of these maybe are part of the answer. But we're going to look at some commonly brought up answers to why healthcare costs are so high. And we'll try to get to, are these really good answers? Are they not? Do they really answer the problem as best as we can? Now, one of the things that's often brought up is that, well, what makes the U.S. unique is that we're just unhealthy. And so because we're more unhealthy than other countries, healthcare costs are more. Well, when it comes to some things, that's true. The United States has some of the highest obesity rates in the world. Now, not the highest, but as far as developed countries, that is true. However, when it comes to other things like smoking prevalence, things like that, we're not as high as a lot of other countries. When it comes to alcohol use, things like that, we're actually not nearly as bad as some other countries around the world. So, do we have some unhealthy practices? Yes, we do. Is it more or less than other countries? That's something that can be debated. In some areas, yes. And in some areas, not necessarily. Right? Another answer that often comes up, and one that's brought up a lot, is, well, the healthcare in the United States is just better. And in previous videos, we looked at the nature of the U.S. healthcare system compared to other countries, and it is true that, yes, generally speaking, when it comes to quality of healthcare, quality of research, quality of technology, it is generally better in the United States than most countries in the world. That's true. Now, does that mean the delivery is better? That's something we can debate. But better healthcare always costs more. Okay, that's fair. Well, in a lot of areas, we do excel. And not just simply technology and better machines and those things. When it comes to preventative measures, the United States is quite good. When it comes to screenings and vaccination rates, far higher than most countries in the world. Right? But when it comes to other areas, lab errors tend to have a pretty high rate, right? And so you're left out, well, we do some things well, we do some things not so well. And so is this part of the reason why healthcare is higher? It is. It's probably part of it. And we could throw in the research cost here. We could throw in physicians' cost. If you get what you pay for, the quality of physician, that's probably fair. Is it all the cost? That's something to debate. Another one is overuse, and the idea that because we have so many physicians and so many aspects of healthcare, so many specialists, right, from orthopedics to endocrinologists to immunologists, right, that there's just so much more of it available that increase costs. And it is true that the number of procedures, whether it's knee replacements or transplant procedures, have increased dramatically over the last decade or even the last couple of decades, more so than most other countries in the U.S. That's true. And so you could say, well, it's because we use it so much. That's why healthcare in the U.S. is so different. Well, okay, that's fair. That's part of it. And you could also say that when it comes to amount the hospital stays cost, even simply using different services in hospitals is far greater in the U.S. Also true. Let's look at the flip side, though. We generally use a healthcare on average about the same as most other countries. There's some countries definitely use it more. There's some countries that use it less. That's true. When it comes to actual hospital stays, we actually have the fewest hospital stays of most developed countries in the world. Now, you could argue, well, yeah, because people know it's so expensive, so they don't want to stay there. That's probably fair. And how some systems are run, particularly in Japan, pushes more hospital stays. That's probably fair too. But we do use hospitals per capita less than some other countries do. And so is this potentially part of the increased cost? Sure, maybe. Is it all of it? It's probably not all of it, but it's some part of it. Another part is the research, and this is one that's often brought up, mostly because there's truth behind it. It is fair to say that the vast majority of quality research done, medical research done in the world, is done in the United States, period. And that research costs money, true. And so because of that, healthcare costs are more. Okay, well, the first part of that's true. When it comes to high quality research, this is actually from the journal Nature, and what they discern as high quality research, the vast majority comes from the United States, true. Now, does that account for all of this increase in research or increase in healthcare costs? Some small percent, perhaps, right? We could throw in here, well, do patents play a role? What part is that in the cost here? So does healthcare research play a role? It does. Is it the biggest role? Probably not. One question that's been brought up a lot, particularly with the Affordable Care Act and a lot of attempting to reduce healthcare costs, is waste. And the idea that because in the United States there's so many entities and so many providers, and because insurers are involved and there's often wanting to reject claims, and with that there's paperwork, that there's a lot of waste and administrative cost. And to a part that's true, that there's far more administrative cost in the United States than U.S. healthcare. So much so that the Affordable Care Act attempted to reduce a lot of this, attempting to get paperwork to be more digital, to reduce a lot of this. And so does this play a role? Yeah, it does play a role. And some percent of expenditures does go to this. Now, is that 100% of it? No, it's not. Is it a few percent? Probably. And we can debate where that percentage is. So is some small part of the increased cost here? Yes. Is all of it? Probably not. Another one we look at, and that's very unique to the United States, is malpractice. The United States, unlike other healthcare systems and unlike other countries, we have a very litigious society. The number of lawsuits we have is substantially high. And so the argument goes, well, because of fear of malpractice and fear of lawsuits, there's increased costs, there's redundancy in testing and procedures that really isn't necessary simply because people are afraid to get sued. And it is true that we spend more and do more in regards to basic MRIs and bone scans and x-rays, and most other countries do. That is true. We do that. And even what we see with C-sections, that's been a big controversy, that the C-sections have gone up, not because of the need, but because of the fear of lawsuit or of other repercussions. And that comes with a substantial increase in healthcare cost. However, most agree that, yeah, although this plays a role, it definitely does. Is it a large role? Probably not. In fact, the CBO, Congressional Budget Office, says this might be 2, maybe 3% of the actual increased cost. Is it a part of it? Sure. Is it a big part? Probably not. Right? Another part of this, and we dealt with this a little bit when we talked about Medicare, is, well, there's more elderly individuals. And so because there's more elderly individuals, they require more health care, so that's going to cost more. Well, as we can see, yeah, elderly populations do use more health care, and that health care costs more money. That is true. But the United States does not have the most elderly population in the world. If we look at this graph, there are other countries that have equally, if not more, elderly populations, and their healthcare costs are, not the same. And so, is this part of the potential role here? Sure, maybe to some degree, but that doesn't explain healthcare costs in other countries. And so, that one, there's not a lot of substance behind that one. Another one that we see that's brought up a lot is kind of revolving around the quality of healthcare, and that's the cost of it, and particularly doctors. It's fair to say that doctors and nurses are paid a substantial amount, and in fact, much more than most other countries in the United States and in the world. Now, the reason being is because of the more market-driven society, the market-driven healthcare. Because of that, the quality of healthcare, there's a cost to that. We don't see the government controls on doctor and nurse salaries like we see in other countries like the UK. And so, yeah, do doctors make more? Substantially more, particularly in lucrative professions or lucrative areas of medicine that are very key. Now, does that necessarily mean that that's the entire reason for increase in healthcare costs in the U.S.? Well, it's probably part of it. Now, is it all of it? Probably not. And we could throw in here, what about administrators? What about other spending? Truth be told, the physician part is probably a small part. And we're also left with the question of, well, if you put controls on this, if you begin to say, hey, physicians can only make so much amount of money, well, now that may introduce other issues as far as quality of care. And do those physicians and other healthcare specialists go to other countries to practice? And so this is not an easy issue to deal with because the answer isn't really clear. The answer may have other problems. Right? So, and truth be told, there is a physician shortage, and that's something we've heard of in the media, and to a degree is true, and particularly in some subspecialties. And so, this clearly isn't the only issue. Well, then what is the issue? What is the answer? And unfortunately, there's not an easy answer. And I think if we want to be objective, it may be some or all of these put together, right? It's partly because things can cost more. Because of inelastic demand, because of the market-driven aspect of the U.S. healthcare system, everything does just cost more. And now this is where we can argue, ditch the system, go to something different. That's a topic to debate. But when we get to why things are more expensive, I think we can at least kind of see that there's a lot of factors involved, and it's not very cut and dry. And there's a lot of pieces that all maybe play a role and why the costs are more. Okay, I hope that helps. I hope it helps to understand a little bit as far as the healthcare costs, why they're so high. And we'll see you in the next video.